Good afternoon. Today I'll be presenting on the data and trends of the United States outbreak of avian influenza, focusing on its effects in Minnesota. In this outbreak, we encountered a highly pathogenic avian influenza, which is in contrast to low pathogenicity avian influenza that has much milder effects. The main subtype of this outbreak was H5N2 and was the primary one of Minnesota cases. Transmission of this disease can be directly between an infected and susceptible bird, or it can be transmitted indirectly through fomites. Poultry producers are to contact their veterinarian if they have an unexplained death of poultry on their property. This critical clinical sign is crucial to passive surveillance of avian influenza. We cannot have a discussion about avian influenza without discussing the risk it poses to Minnesota's poultry industry. Minnesota is the largest source of turkeys in the world. We have 600 farms that produce 46 million birds annually. We have the world's largest turkey hatchery and the second biggest processing company. Our chicken industry is substantial as well. Our egg production is in the top 10 of the country, and broiler production is in the top 20. The objectives of this presentation are to examine the surveillance information from the 2014-2015 avian influenza outbreak in the United States. Before we dive into the data, we will outline methods and data sources. Then we will consider data at the national level and then at the state level of Minnesota. We will then discuss public health and economic implications this outbreak had in the United States and then specifically in Minnesota. To wrap up, we will look at public health recommendations for avian influenza. We are going to briefly summarize the process of identifying an avian influenza case in Minnesota. First, a poultry producer notices an unusual death in their flock. They then call their veterinarian, who will collect a sample and send it to a state facility to be tested. If the test comes back positive for an H5 or H7 avian influenza subtype, it is considered a presumptive positive. The sample is then sent to a national lab. If it is confirmed, the USDA will add the case to its online database for stakeholder and public access. To be confirmed as a USDA case, the sample must test positive on a PCR test at an NVSL lab. Our main data sources were the USDA APHIS and the Minnesota Board of Animal Health. USDA APHIS is the National Avian Influenza Surveillance System, and the Minnesota Board of Animal Health is Minnesota's main point of contact for animal disease surveillance. Now we are going to discuss the avian influenza surveillance data. First, we will cover it at the national level. On the 223 properties that were affected by this outbreak, over 48 million birds were depopulated through control measures. As this graph shows, chickens and turkeys were by far the most affected species. However, there was some loss at mixed poultry, mixed game fowl, and pheasant properties as well. This table shows the poultry mortality per month of the outbreak, as well as the number of corresponding properties. Outbreaks like this one can sometimes begin very slowly, allowing them to grow without much notice. Then, as the virus reached states with higher densities of poultry, like Minnesota and Iowa, in April and May, we see our greatest losses. This graph illustrates the number of properties with more than 5 reported cases of avian influenza during the outbreak. During the whole outbreak, 21 states had USDA confirmed cases. It began in Oregon in December 2014, and the last reported case was in Iowa in June of this year. Our state, as you can see, had the most properties with reported cases, and Iowa had many affected properties as well. At this point in the presentation, we are going to focus on Minnesota surveillance data. The map on the right of this slide illustrates a gradient of the amount of properties affected in different Minnesota counties. The trend of this map is the more south we go in the state, the more properties are affected. This could be explained by the density of poultry farms tends to increase as we go south as well. We had 25 counties overall with reported outbreaks of avian influenza. Our southern counties had the most properties affected, but it was the counties that had the most poultry, and the most contact with other affected counties that suffered from higher bird mortality rates. Minnesota lost 18% of the 48 million birds that were depopulated in the country. The outbreak in this state was limited to March until June of 2015. Our first case was in March 4th, and as you can see by the graph, we had the highest peak in April, with decreasing numbers of reported outbreaks until the beginning of June, when Minnesota had its last reported case. Now we are going to review bird mortality data. Of birds that were depopulated as a result of this avian influenza outbreak, the population of commercial chickens suffered the loss of over 1.5 million chickens, but the largest percentage were from commercial turkey farms, who overall lost over 4.5 million turkeys. Although in Minnesota, commercial turkey producers lost more birds overall, commercial chicken producers in the state lost more chickens per property than turkey producers. This trend could be a consequence of production scale, however, as chickens are typically grown at higher population densities than turkeys. That concludes the overview of national and Minnesota level surveillance data of the avian influenza outbreak from December 2014 to June 2015. Now into implications. The central public health impact was the loss of over 48 million birds, none of which were able to enter the food system, as is the protocol during an avian influenza outbreak. Although no humans became ill as a result of this outbreak, there was always a chance the virus could mutate to become zoonotic as it has in the past. Therefore, control measures were always undertaken to minimize risk of infection to humans, which increased the resources spent on containing this outbreak. There have been major economic implications as a result of avian influenza as well. This outbreak has resulted in both egg and turkey price increases. There could also be a decreased availability of turkeys at Thanksgiving this year, especially with Minnesota being so majorly affected. Every turkey that Minnesota provides produces $17.46 of income to the industry. With a depopulation of over 4.5 million turkeys, this results in an $82 million loss for the state. The Minnesota Board of Health and the Department of Natural Resources have some recommendations to assist in the surveillance and prevention of future avian influenza outbreaks. If you own birds in Minnesota or any other part of the country, you should alert your veterinarian or a state veterinarian if you have unexpected deaths in your flock. You should try to limit the contact between your birds and birds from other properties. This includes and especially applies to wild birds. Do not wear clothing, shoes, or boots that have been to other bird properties around your birds or their enclosures. Also, it is best to keep your bird feed in a location that is inaccessible to wild birds. To assist the DNR with surveillance, report any dead wild birds by calling their Wildlife Health Program Supervisor, their Wildlife Health Specialist, or your local DNR contact. All of this information will be made publicly available after this presentation. Thank you and have a good day.